11-month-old baby. The baby name is, she's a girl, Sarah, and mother is Mira. You have to take the history from the mother, Mira. The chief complaint is that she is suffering loose motions and vomiting.
Okay. All right, Dr. Emma, can I start now?
Yeah, of course.
All right. Hello, good afternoon.
Good afternoon.
I'm Dr. Teresa, one of the child doctor. I believe I'm talking to Miss Mira.
Yes, I'm Mira.
Okay. Okay, you might be the mom of Sarah.
Yes, Sarah is my
Okay.
baby.
Um, yes. Today I'm here because I want to ask a questions regarding Sarah's health. Is that okay for you, mom?
Yes, of course.
Okay. I understand that Sarah has got problems with loose motions and then vomitings. Can you tell me more about it?
Yeah, my Sarah, she just a long time she's suffering this vomiting and this loose motions, and I'm today here because why that is happening to know.
Yes, yes. That's a really good decision that you have came to us. But I will need to ask more questions regarding these vomitings and loose motion. You mentioned it's been for a long time. Can you tell me when did you exactly notice those vomiting and loose
I
motion?
think that is last 6 months, maybe.
Okay. And does loose motion started first or vomiting started first?
I think alternatively, loose vomiting sometimes vomiting. That is happening.
Okay, all right. So, I want to ask about is vomiting and loose motion is not all the days or it's like often on? Am I correctly
On and off.
interpret you?
That is on and off.
Oh, okay, all right. If the child is having these vomitings, how many times in a day does he vomit?
It's on and off. When she vomits, it's like 2 time, 3 time like that.
2 to 3 times a day. And what is the type of vomitus? What are the ingredients?
Vomiting the food context, I think.
Okay, and is there any change in colors, like any blue, any green colors you notice?
No, I don't think. Just food content.
Is there any blood you notice along with this throw up?
No.
Okay, and does anything make this vomitings severe or aggravates?
I don't know. It's what actually aggravate this vomiting.
Okay, and have you tried anything just to relieve this vomiting?
Yeah, I have gone the GP for the vomiting. Actually, vomiting start earlier. Then the GP told that it's normal in this age. Then I have not gone.
Okay. Just to make sure that sometimes children after eating they tend to regurgitate the food, so it's not like the forceful one. So is this like just a mouth of the food split out from the mouth after feed, so it's like a forceful vomiting?
It is not a forceful vomiting. It's just normal vomiting.
Okay, all right, okay. And then let's go back to the loose motions. If the child psoriasis has a loose motion, how many times she opened the bowel?
Daily 2 to 3 times it happen when she suffer
Okay.
this.
All right. And what type of can you tell me the consistency during this loose motion time?
It's loose.
It's like a watery.
Yeah, yeah.
Okay. And does the smell is too much?
Normal smell.
Normal smell. Any blood you notice?
Yeah, 2 to 3 times I notice blood. Stick on the nappy.
Okay.
She or still on the nappy.
Is the blood is just a stain or it's like a profuse blood?
Yeah, with the stool, I think it stayed the blood.
Okay, okay, all right. And what is the colors of the poo? Is this yellow or green or pale?
It's yellow.
It's just a yellow colored. Okay, and do you notice does anything make these loose motions worse?
I don't know actually what is making it worsen. One off is vomiting. Sometime it come well,
Okay,
sometime it. Nowadays it really. I think increasing.
Okay, yeah, it must be worrying for you. Have you tried anything that you notice that relieve this kind of loose motions and vomitings?
No, nothing.
Okay, you haven't done anything before. All right. Okay, then I need to ask: is there any fevers, temperatures?
Actually, not fever. Sometimes it is like a low grade figure, otherwise not.
Okay, you mentioned that sometimes there's a low grade fever. So, does the fevers occur during the times of loose motion and vomitings, or they are apart?
Now, this time occur. Sometimes, not always, it is associated with fever.
All right. Is Saras is currently having these loose motions and vomiting?
Yeah, for that reason I have hair.
Okay. So can you tell me since when did Saras this started this vomiting and loose motions these days?
Yeah, last 10 days I think it's occurring.
It's been 10 days. All right. And is the amount of the vomiting and loose motion the same as that were previously, like 2 to 3 times a day?
Yes.
Okay, all right. Right now, Saras has any fever or temperature?
No.
Okay, any tummy pain that Saras has?
Yeah, sometimes tummy pain. I feel she is crying for tummy pain.
Okay, right now, does Saras look any pain or tummy?
Mm, not pallor. I don't get what you ask.
No, right now, does
Mm.
Saras has any tummy pain?
Yes, yes. She has tummy pain last 10 days also.
Where exactly? Can you point to me?
I don't know what exactly. She's just 11-month old. I feel her movement that she's screaming with pain.
And does she cry all the time because of the pain, or it's like often on?
Off and on.
Often on. And is there any specific times that she feel pain, like before going for the pool?
No.
All right. And and do you notice any change in terms of weight?
No, her weight is okay.
That is great. What about sleep? Any problem with sleep?
Yeah, sometimes she's really irritable with this.
Okay. Um, so because Saras is having vomiting and loose motion for 10 days, that means that she might probably lose the fluid. So I'm going to ask you some symptoms that might indicate the dehydrations. Do you notice any change in terms of Sarah behavior this day?
No, just she is irritable. Nothing else.
Irritable. Is Sarah's look more thirsty?
She actually, I have given her normal saline, no problem occur, and she
Okay.
drink milk.
Oh, all right, all right. So you have given enough fluids after every loose motions or the vomitings. All right,
Yes.
that's great. All right, that's good. Is there any skin rashes? Do you notice?
Yeah, she has some eczema.
Okay, where exactly the eczemas are?
Ah, I think whole body, tummy, some are back, some on the leg, face.
And and is the eczemas? What did he start diagnosed with?
She's eczema from the birth. I have seen some skin lesions. We have given some emollient
Okay,
for that. That's all.
all right. Is her eczemas under control with emollients only, or does it need any other medications?
Actually, it control, then it again come back.
Okay, so whenever there is a vomiting and loose motion, the eczema tend to get bad. Is this like this?
Yeah, yeah. Also, sometimes it increases with this.
All right. Do you know any trigger factors for our eczema?
I don't know that. What is the trigger factor?
What might be the trigger? You don't know it. Okay, no problem. Does SARS has any abnormal movements?
No.
There isn't any abnormal movement. That is great.
Nine
And I
minutes.
want to ask. Okay. Does SARS has any repeated history of chest infection?
No.
No repeated history of chest infections. Okay. Do you notice any change in terms of skin color?
I told you, na, she is suffering eczema. That's why sometimes it is occurring reddish color.
Okay. Any yellow color do you notice in terms of the skins and eye?
No,
Okay, that is perfect. All right. Any joint swelling, joint pain do you notice?
no,
Okay, great. So do you know do you have any concerns regarding Sarah's growth?
no. I feel okay, but she's not gaining too much weight, but it's not losing.
Okay, when did you start notice that she is not gaining weight?
Last 6 months she is on and off, on and off. This problem is suffering, and I feel that.
All right, okay. I want to ask about some diet history. So Sarah is 11 months old. So what is her current diet is?
She is on regular diet, what we eat, but she used to take milk 3 times as she is loose motion, so I give her milk much more, and that's all.
All right. When did Sarah started on a weaning diet?
Like 6 months back, when she just
Six
crossed the
months.
6, I start.
Okay. And and currently, apart from the mix, what can you tell me more specifically about what type of diet does Sarah's diet include?
I told you that she eat like we eat. She eat fruits, chocolate, candy, milk. She
Mm-hmm.
eat some saline I have given, rice, dessert, banana. Sometimes I give her cooked food, chicken, everything I am giving her. Little amount, egg,
Okay.
everything she eats.
Okay. And do you feel like is there any food that might trigger those kind of symptoms?
Actually, I don't understand that what is
Okay.
trigger or nothing, or she has any disease or not.
All right. And apart from the eczema in the past, does Sarah has any other medical problem?
No, that is this problem she's suffering.
All right. Any history of admission, hospital admissions?
No, she has never admitted in the hospitals.
Okay, that's great. What is the family history? Does any family member has any history of allergies or
Yeah.
eczema?
Yes, yes. Her father has some eczema problem. Similar she gets.
Okay, okay. Any food allergy in the family members?
Yeah, family member. I think his father has some seafood allergy.
Seafoods allergies. Okay. Any history of asthma?
His father has some asthma also.
Okay, all right. And is Sarah's is the first child? So is there any other children at home?
Yeah, I have my another child who is Ronnie.
Mm-hmm. So how is Ronnie?
Ronnie is 4 years of age and he is okay. He has also some
Okay.
eczema.
Okay, Ronnie has eczema. Okay. And what is the housing's conditions? Is there any, can you tell me about house? Is there any pets at home? What type of furnitures?
My house is a regular house. Nothing special, but it's normal house. Not too small, not too big.
Okay, is it well ventilated?
Yes, well ventilated. I decorate
All
it
right.
very nicely.
Any pets?
No.
Okay, okay, that's
Okay, I
great.
think
So,
time is over.
all right. Okay.
Can you please present your case?
So today I have taken history from Mrs. Mira, who is mother of Sarah. Sarah is 11-month-old child presented with the long-term history of 6 month durations of vomiting motions off and on. Her current symptom is has having a vomitings and loose motion for 10 days. It was about 2 to 3 times a day. Occasionally included some blood stain in the poo. The child does not have any features of dehydrations at that time. She also complained with the colicky abdominal pain, and there isn't any fever. However, the child growth is standard since the age of 6 months. The child has a strong family history of eczema, food allergy. She also has a history of eczema since birth. Based on that history, I believe the child having loose motions and vomiting, probably because of either allergy problems, either food allergy, or it may be because of other malabsorptions type
Which
syndrome.
food allergy you want to tell?
I haven't specifically elaborate what type of food is causing the allergy. However, the child studied in the milk, and I believe milk might be the source of this allergy problem. But I cannot ask specifically about what type of food is causing the allergy.
Okay, okay. Thank you very much for your participations. First of all, the history was not complete. Do you try to organize that? You have not take the birth history, not vaccinations, nutrition history take, development history have not taken. Family, social, psychological cannot able to complete. These are the history. So that is a cow's milk protein allergy. You need to ask about. I have 2, 3 times she's taking milk. I told you, and the history is come back just when the winning started, 6 months back. I told you. So you need to ask about that. Do you introduce cow's milk? How many times she's taking this cow's milk? Okay. And
Yes.
we have two chief complaints today. Chief complaints is vomiting and also loose motions. So if vomiting, we ask that when it started, how long, what increase and what decrease. Any diurnal variation, first vomiting I analysis, diurnal variations like morning vomiting, describe the color, green and content, blood or mucus, frequency, is it projectile in nature, does he vomit everything, is it spontaneous, after feeding, after cough, hitting the wall, exhausted, fatigued, sick. Sign of any dehydration like cold peripheries, heart racing, sunken eyes, plus minus anterior fontanelle, P amount, number of nappies. So these are the vomiting analyzing. Then loose motion we ask the how long already we asked the amount, color, consistency of the loose motions, contain blood or mucus and difficult to flush. Difficult to flush because for the celiac disease or associated with food particles associated with vomiting. Okay. Then general condition like fever, weight, activity, sleep affected or not. Then we go the systemic review one by one. First, start from the GIT. Is the tummy pain, increase the tummy size, tummy swelling, dilated blood tubes on the tummy surfaces, poo. Poo, our chief complaints. So already we analyzing. Then any long term, any chronic condition the child is suffering, any other concern. CNS like increased intracranial pressure, headache, weakness, facial asymmetry, eye deviation, neck stiffness, abnormal walk, abnormal movement, mood change, head size. Lots of vision and hearing. Lots of things not needed to ask. Just we need to recognize our case. Then chest, any coughs and cold, bugs, difficulty in breathing, blue lips, abnormal breathing, CVS, heart racing and fainting, urinary, P color, amount for the P color, P amount, very important for dehydration. We are asking. MSK, skin spots, pigmentation of the skin, mouth, swelling, lumps, pain of the muscle, bones, joints, carving or deviation of the back, hair and nail eczema, hematology as usual, endocrine as usual, cold or hot intolerance, any swelling in front of neck. And past history, 5T IO, any treatment, blood transfusions, any traveling history, any trauma history, any surgery. These are routine questions we will ask. Then perinatal birth history, as usual, meconium passage, vitamin K, heel prick test, admission to NIQ, anything puberty not needed here. Vaccination, allergy is very important. Is that milk allergy, child presents or not? What type of milk taking? Cow's milk. Nutrition details you have to ask. Development as usual and family social psychological. You can ask like who take care of the child when you are not at the home. We know everything financially status, what you do for living. Describe your home. Any similar condition in the family. How many people are living together? How this disease impact. This 11-month old child has no school, so don't need to ask about the school. Okay, this is about our history, and we know that red flags of a loose motions are dehydration, severe frequent diarrhea, failure to thrive, bloody diarrhea, systemic upset, and recurrent oral thrush. So our history, the child is not failure to thrive. He is good. I am now discussing about the cow's milk protein allergy. It comes on exam. It comes cow's milk protein allergy in exam with mixed with the celiac disease. On the history, the family history of disease is positive. So second it is celiac disease in exam. So cow's milk protein allergy intolerance, that is a definition, is a reproducible adverse reaction of an immunological nature induced by cow's milk protein. Classification according to the timing of symptoms and organ involvement. That is immediate reactions and delayed reactions. Immediate reaction which are typically immunoglobulin E mediated type 1 reactions. A delayed reaction which is typically non-immunoglobulin E mediated. So our one is non-immunoglobulin E. Sign of immediate cosmic allergy, immunoglobulin E mediated, that is urticaria, hives, angioedema, eczema exacerbations, vomiting, diarrhea, bloody stools, gastroesophageal reflux, abdominal pain, rhinitis, wheeze, stridor, difficulty breathing, hypotension, shock, irritability, evidence of anaphylaxis. So that is immediate reactions. And sign of delayed cow's milk protein allergy, non-immunoglobulin mediated are gastroesophageal reflux, like our case, eczema, exacerbations, diarrhea, constipations, bloody stools, feeding problems, irritability, colicky. Everything I told you, colicky because tummy pain, the child cry. So this is our case is non-immunoglobulin mediated delayed type of cow's milk allergy. Diagnosis of cow's milk allergy. How can we diagnose in primary care? Delayed type of cow's milk allergy is like a detailed allergy focused history. An examination will most often identify children with delayed cow's milk allergy. Resolution of the symptoms on a dairy eliminations diet over 2 to 4 weeks, followed by return of the symptoms on a home challenge to dairy remains the diagnostic gold standard. So we do the food challenge test. We exclude the cow's milk, then 2 to 4 weeks, again we introduce, then we see that the symptoms is coming back or not. Blood and skin allergy tests are not useful tests in assessing delayed cow's milk allergy. Immediate cow's milk allergy is action should ordinarily be to refer to secondary care for further investigation, skin prick and other blood testing. Immediate cow's milk allergy immunoglobulin immediated is typical history, positive skin prick test, and raised specific immunoglobulin E to the milk. And delayed cow's milk allergy non-immunoglobulin immediated, there is typical history, positive home challenge test, negative skin prick test, negative specific immunoglobulin E to milk. So this is cow's milk allergy.
Thank
Differential
you.
diagnosis of cow's milk allergy are it can be colic, the child is crying, colic, eczema, constipation, urine tract infection, gastroesophageal reflux disease. Our DD can be gastroesophageal reflux disease. Child vomit. Other food allergy can be present. Faltering growth, lactose intolerance. These are and immunodeficiency. As long time the child is doing, but the child has weight is normal. So the age, everything is telling that cow's milk protein allergy. Now, what is the indication for referral to secondary care for delayed cow's milk allergy? When we refer, if diagnostic is uncertainty, faltering growth, does not respond to the first line treatment, severe eczema, where multiple food allergies are suspected, and food protein induced enterocolitis syndrome. Now, specialist cow's milk free formula. Two type of formula fits this criteria. Number one, extensive hydrolyzed formula. It is usually the first line formula in which the milk protein has been extensively hydrolyzed to reduce the allergenicity, and amino acid formula. It is that the protein sources are pure synthetic amino acid and it is completely free cow's milk protein. So these are extensive hydrolyzed formula and amino acid formula. Indication of amino acid formula are previous anaphylaxis to cow's milk, reaction to one or more EHF. EHF is that and faltering growth, severe symptoms and multiple food allergies. Breastfeed infants who react when the mother is on a dairy-free diet should move to AF, amino acid formula. So these are the indication of amino acid formula. Okay, this is all about cosmic protein allergy. We are going next.